So let's talk a little bit about some of the causes of chronic pelvic pain. I'm primarily talking about things that are not venous in nature. We'll have another video that explores those issues in detail. As I've mentioned previously, chronic pelvic pain is pain that lasts more than 6 months. It may be pain that comes and goes, but it's pain that's been going on for some time. And that excludes some causes of pelvic pain. If it's chronic and is coming back over 6 months, you know some things are not going on. It's probably not acute appendicitis. There is a rare patient with what they call chronic appendicitis, where the appendix is inflamed and it clears up and then it gets worse again. Those exist, but they're not terribly common. So what can happen? Well, over here you can have an ovarian cyst that just isn't going away, that's stretching the tissue and causing pain. You can have a tumor or a solid growth within the ovary that can be causing pain, and that won't go away on its own. You can have a fluid collection in the fallopian tube from chronic scarring, usually from mold infection. There's another condition called adenomyosis, which is thickening of some of the tissues that secrete fluid inside the lining of the uterus. That'll cause pain, and that's not an uncommon cause of a need for surgery. One can have endometriosis, which is an implant of some of the cells similar to those that line the uterus as the uterus prepares for an implanted egg. But some of those cells can get out through the fallopian tubes or through the bloodstream into other parts of the body. And the most common location for endometriosis is on the tissues surrounding these pelvic organs. It could be on the intestines or the lining within the pelvis itself, or on the outside of the uterus or ovaries and fallopian tubes. And so endometriosis can cause pain sometimes. As far as the intestinal things go, ulcerative colitis involving the colon is an inflammatory condition that can cause pain. Terminal ileitis, or Crohn's disease, is an inflammatory condition of the small intestine mostly that can cause pain that can come and go. And some of these are so bad that they require removal of portions of the intestine at times. We mentioned earlier that you can have acute diverticulitis causing short-term pain, particularly in the left lower quadrant of the abdomen or pelvis. And occasionally that becomes a chronic condition with just chronic pain that just isn't going away. That can do that. We see a large number of patients who have a diagnosis of irritable bowel disease. They have abdominal bloating and cramping, and they've had all kinds of gastrointestinal workups that just haven't come up with any definite explanation for their symptoms. So they get labeled irritable bowel disease. At least some of this is spasm and contraction of muscle in the wall of the intestines, and then that causes other segments of intestine to stretch with cramping and discomfort. That's actually a difficult diagnosis to absolutely prove, and mostly it's a matter of ruling out other serious problems before one labels that diagnosis on a patient. Then there are vascular causes for chronic pelvic pain. We will review those in another video. There's a rare arterial cause for chronic pelvic pain that usually is the elderly patient with stretching of the arteries or aneurysms in the arteries in the pelvis. That's actually quite rare for it to be in the pelvis. But we'll talk primarily about venous causes of chronic pelvic pain, and those are important because most of them can be treated with considerable improvement in patients' quality of life. So it's important to be able to distinguish those when they exist and then to offer treatment when other causes for the pain have been ruled out. Thank you.